Hello, my name is Roger Jones, and I'm coming to you from steaming downtown Pensacola, Florida. Today, I'd like to talk a little bit about our visions for healthcare in the United States. A few years ago, before the political explosion in the United States, I attended the Forbes Healthcare Summit in New York City. There were over 200 healthcare leaders were converged on Lincoln Center to discuss and forecast the future of healthcare in the United States. In this conversation, I would like to focus on two different visions for the future that emerged in the conference. The first vision is an extension of our current trajectory in which space age technology yields dramatic but expensive health outcomes. The second vision is one in which common sense medicine produces low cost, very good health over a large segment of the population, but is not necessarily designed to accommodate specialized high technology procedures. Former Governor Rick Perry of Texas championed the high technology vision. Perry outlined how certain policies in Texas, such as tort reform and no income tax, attracted high-end medical specialists to the state. This set the state up as a destination for medical tourism that attracted very sick patients from all over the U.S. and wealthy patients from all over the world. This provided the state with a healthy income. When asked whether this process should be implemented nationally, he claimed that the federal government was not able to deliver on a vision like this. It was clear, however, that implementation at the national level would degrade Texas' competitive advantage over the other states. When asked about non-specialized medicine and primary care in Texas, Perry was candid that many Texans were not receiving adequate primary care. He gave as an example the population along the Rio Grande that had to travel several hours to access prenatal care. He mentioned that Texas was looking at some loan forgiveness for Texas medical students who were willing to spend 5 years in rural settings. But clearly, when he talked about this, the sparkle was missing from his eyes. At the other end, Bradford Burke, CEO of the University of Rochester Medical Center, and David Klein, CEO of the Lifetime Healthcare Companies, or healthcare funder in the Rochester area, championed the second vision. They described a collaborative system that focused on providing low-cost, high-quality healthcare at a community level. This system emerged as a cooperative arrangement among large local employers such as Kodak and Xerox, and a first-rate medical school at the University of Rochester. Of course, Kodak and Xerox are shadows of their former selves in Rochester, but the system they helped create still exists. The key observation was that, contrary to traditional economic theory, increased healthcare supply increases cost. This cynical view is that medical entrepreneurs increase the number of hospital beds and then prescribe to fill the beds. The Rochester team decided to right-size the supply of healthcare in the community and to focus on outcomes. That was possible because of the economic motivation. That was possible because of the economic motivations of the community businesses who were funding the healthcare and cooperation of the medical school. The Rochester community succeeded in its goal of providing low-cost, high-quality health care. Of course, if an upstate New York resident needs a very exotic procedure, he or she may need to fly to Texas. It is clear that the U.S. cannot continue its current course in which healthcare costs are more than 17 or 18% of GDP, and outcomes such as lifespan, infant mortality, medical mistakes are significantly behind the rest of the world. Typically, the U.S. ranks 40th in those measures. It is also clear that Americans are an optimistic people with a firm belief in the idea of progress, which manifests itself in technological and business innovation. The two visions for healthcare that were presented at the Forum's Healthcare Summit are almost caricatures. There's opportunity for creative individuals and institutions. Technology has not been applied evenly in healthcare. While the U.S. can be proud of its innovations in high technology procedures, its adoption of information technology is not even at the level of the pizza industry. Both visions emerged as a result of economic incentives, one to increase revenue, as was the case in Texas, and one to reduce costs, as was in the case in upstate New York. The question now is, how do we shift the incentives to create the proper mix of outcomes, cost, and risk? If you'd like to know more about this and other topics, you might be interested in picking up a copy of a book that I wrote with my colleagues, John Casti and Michael Pennick. I'll put the details of how to get a copy down below. At any rate, this is Roger Jones signing out from steaming downtown Pensacola. If you want to meet up again in space-time, go below and click the subscribe button. Thank you. Till next time.